Welcome to Coffee and Community, Cutaneous Lymphoma Conversations, brought to you by the Cutaneous Lymphoma Foundation. I'm today's host, Holly Priebe, and glad to have you with us. Joining me today is Allison Fitzgerald, Director of Operations for GlobalSkin. Allison oversees operation, finance, and research. We're so grateful to have her with us today. So grab your favorite cup of coffee, settle in as Allison and I discuss GlobalSkin's GRIDD and PRIDD projects and how they're making a difference in skin diseases and more specifically, cutaneous lymphomas. Welcome, Allison. Thank you for joining us today.
Hi, Holly. Thanks for having me.
Absolutely. So probably we should start with building a foundation and kind of just letting our audience have a clearer understanding of what is GRIDD at the high level and what is PRIDD at a high level and what makes them different.
So, I guess about 10 years ago, when GlobalSkin was founded, one of the key mandates they took on was to create the ability to turn qualitative data into quantitative data. There was a recognition at the time that it was very, very difficult for governance and decision-making bodies to use qualitative data that was around from organizations such as yours and use it to make robust decisions. And so one of the things GlobalSkin decided to do was put together this GRIDD project. And this is the oversight project. So it's global research into the impact of dermatological disease. As we know, the impact of derm diseases such as cutaneous lymphoma are really underrepresented and undervalued in terms of understanding their burden to patients. So as the GRIDD project got started, one of the things they realized is there wasn't really a decent measure or a way to validate the burden of skin disease. So there are measures out there, but they weren't driven or created by patients. They didn't apply to all regions around the world, and they often didn't apply to specific diseases, again, like cutaneous lymphoma. There wasn't really a burden of disease measure out there for that. So part of the GRIDD project, after doing a scope analysis, was that we needed to create a measure which became PRIDD. So that's known as the patient-reported impact of dermatological disease. So thus, GRIDD and PRIDD sound very similar, but one is the project and one is the result of the project, which is a new measure of skin disease that includes patients like those with cutaneous lymphoma in the creation of it.
That's a mouthful. It's
Yeah.
a lot of information, and you did a beautiful job of simplifying it for our audience. Thank you so much. So, what is important for a patient community to know about why these exist and what that could potentially mean for them?
So a number of things, but at the end of the day, what patients really want people to understand, so whether it's your healthcare professional, whether it's your decision-making bodies, whether it's advocacy that you do, is that you are so much more than the physical burden of your skin disease. And so what this project is it understands that there's a lot of information about there specifically on the physical manifestation, such as cutaneous lymphoma, but there's so much more that goes with it in terms of mental burden. So impact on your social, impact on your psychological life, impact on your wallet, as well as the physical impact. And so what we did with PRIDD was acknowledge that these all exist. And you can then take this information when you go to governing bodies, when you go to decision-making bodies and say, look, you guys need to factor in far more than what you're already factoring in. We want to provide you data that will then help you make decisions on more than just the skin aspect of what it is you're making a decision on. You need to know that with my skin disease, I sometimes can't work. With my skin disease, I sometimes won't go out in public because I'm too embarrassed, or I hurt too much, or I itch too much. It impacts how I live. It impacts my relationships. It impacts my ability to work. So what this measure will do is allow you to take it to whatever body it is that you're talking to, even just directly with your healthcare provider, and say, I'm more than just my skin. I need you to take that into consideration.
So, cumulatively, we can do that as an organization with larger data sets. How will an individual use it, or is this not intended for individuals specifically?
Yes. So the primary reason we existed is really to help the patient. And so There's a term out there called shared decision making. It's just your ability to have a conversation with your doctor or your healthcare provider. And what you can do with PRIDD is we turned it into an app that you can download where it's all right there for you. You complete it, and then you can either download a PDF of your results, or you can just show the doctor the results and say, I really need to talk to you about more than just my skin. So what we're really hoping is that it launches you into a fuller discussion with your healthcare provider, be it the nurse, be it the dermatologist, be it the person at the front desk while you're waiting to have your appointment, to have a more robust, full discussion about how it is you're living your life when you have this disease, and is the changes you are making actually having an impact on how you do it.
Oh, that's great. So can the app be filled out with every appointment, or is that something you do one and that's it?
No, the app can be filled out at every appointment. We recommend at least a month in between because we know with certain skin conditions, it takes a while for the work you're doing to improve how you're living to take effect. So every 4 to 6 weeks, you can fill it out and you can track improvements, or maybe there aren't any improvements. Maybe things are not going as well as you want and are in fact getting worse. And then you can track it month by month or every 6 weeks, whatever you choose. And so you have a steady idea of how it is you're progressing with your skin condition. It's all retained on the app. So you can see I filled it out every month for the last, I think we've had it out for 8 months. And so I can see a steady progression as I go.
Individuals can see their own progression.
You can, that's part of the app. Yes.
Oh, that's excellent. I love it.
I'll add too, kind of the cool thing about the app, it was important from a research perspective, but we made sure it was included in the app for the patient as well, is that you can see 4 different domains. So when PRIDD was developed with patients said, look, we need you to understand there's a social, there's a psychological, there's a life responsibilities impact. And we took that into consideration and we said, you know what? Then we're actually going to validate these subdomains of the measure as well. So you can track not just a total score, but you can also see how you're progressing or not progressing in the psychological domain, in the social domain. So you can actually get 5 scores with which to keep track of what it is you're doing. And so you might find psychologically you've been getting some mental health help and you see some improvements there, but it's not impacting you socially or in other areas. So there's a lot of ways of using the app for both yourself and for having discussions with your healthcare provider.
That's great. Do the healthcare providers know about the app? Have they been educated on it being there?
That is one of the things we're going to be working very hard on in the future. No, we wanted to start with the patients first, get the tool available to them. And we also need a robust body of evidence behind us because we know it's important for healthcare providers to have the science. Is it a valid tool? Is the science behind it mean that the discussions we're having are actually valid discussions? And so we've been working really hard behind the scenes to publish. So there's 7 publications that you can see with links on our website. And I think your foundation would also provide the links. If you take this to your healthcare provider and say, look, it's a valid, well-published, patient-created measure, here's where you can learn more about it, your healthcare provider will take it a little bit more seriously. Now that that's fully underway, we're working at getting into conferences and getting in front of healthcare providers, but they were a little bit further down the list.
No, that's great information. Actually, that was kind of one of my questions was where has it been presented and or published?
We've published in probably some of the leading journals, including the JEADV, the BJD. I can't think of the other ones off the top of my head.
It's excellent. So those are journals that dermatologists globally are reading or within the United States, Canada, those are global journals?
They're global. One is out of Oxford University in Britain. So the BJD is run out of the UK. JEADV is a European magazine. So
what does it mean? What kinds of things are included in a publication that would go into a journal like this?
This is where you get fairly scientifically rigorous in understanding how the measure was developed. This is a way for you to understand that the patients around the world have said these questions are really important to us, to the point where we have run psychometric testing, rash analysis on the item generation in the measure to say, This is important enough. It's made it into the measure, and we really want to talk about it because this is how you understand the burden of disease. It's the robust validation of the process that went into creating the measure so that when they understand it, they can say, oh, wow, you guys did a lot of work with patients. You followed all the proper research parameters. You wrote excellent manuscripts that were peer reviewed to say, yes, you did all the work that needed to be done. You actually went above and beyond. You looked at Cosman criteria. You use the best possible analysis methods out there so that a doctor or a healthcare provider or research looking at this will go, I can actually use this measure to build really good evidence that can be presented almost anywhere and truly show the burden of the patient. Which means when a patient takes it to their healthcare provider, they can say, look, this is really meaningful to me, therefore it should be really meaningful to you for us to talk about.
That's excellent. That's great information. So, knowing that you've published, knowing that the idea is eventually we're going to, hope that physicians start picking this up and this becomes a tool that they're recommending to their patients, not just patients driving and bringing to
One
their
hopes.
physicians.
Yes.
What are the on the horizon plans for Global Skin and data and publishing and kind of what's next? What do you have? What are you thinking about?
So many answers. You might have to ask me that question a couple of times. I'll
Yeah.
forget all the ideas we have. So, from an individual perspective, we're hoping to work with organizations such as cutaneous lymphoma to use PRIDD in their research, which will then benefit all cutaneous lymphoma patients. It was validated with cutaneous lymphoma patients as part of it, which means it also highlights things that are important to you. If Cutaneous Lymphoma Foundation can use it, add it to the studies that they use, they know they will have very valid burden of disease information to work with to share an advocacy on your behalf, which is pretty cool. We are going to take not just the data from CLF using it, but the data from other patient organizations. We're hoping to encourage, teach, promote, to use it and pull that all together. And it can be used for advocacy at a national level. It can be used for advocacy at a disease specific level. So if you get all atopic dermatitis patients together, you have a pretty powerful body of evidence to advocate for atopic. So if you're looking to influence it at a country level, you're talking to payers, you're talking to HTA bodies, and you're going to them and saying, look, you might not think this is really important to us. You're looking at a treatment for us that is potentially just to cure itch, but we're telling you we need more than itch, we need this. So you're taking it to HTAs and payers saying, you guys aren't doing it quite right. The body of evidence on burden of disease is saying that we actually need to go in this direction, or this such and such is really important to us. We're pretty new into it. We haven't quite figured out what that means for everybody yet, but we do know that burden of disease evidence is going to play a role, especially in advocating for access to healthcare, to improve training for other healthcare professionals in identifying and looking at skin diseases. So maybe faster identification of people with cutaneous lymphoma so you don't have to wait so long in terms of getting recognized in the disease that you have. And then just improving how people understand the impact of having a skin disease, because we know globally it affects the number of people who are able to work, the quality of work they are able to do, the social life that they're able to have, the quality of life that they're able to have. And we know that in certain countries who potentially don't have access to dermatologists compared to other countries, even just getting a diagnosis and being able to contribute to society would be improved simply by having access to somebody who can identify what they have. So we know both individually right through to globally, understanding the impact of a dermatological disease can be quite significant.
It's going to do great things, no doubt.
We
No
hope.
doubt. So we get the concern of patient providing feedback or participating in data collection in that, their privacy. And what would you say to the patient who has concerns about downloading an app and providing their own information into the app? to help them understand the security or the benefit, risk benefit around your survey? Because obviously the foundation wouldn't put out something that, to potentially put somebody in harm's way. But as the creator and the manager of this data set, to kind of help our community better understand why should they participate? Why is it safe for them? And what are help them understand that, please.
Sure, I can address two parts of that. So, first, the app, only you have access to the data that's on the app. Even our app creators and providers can't get into what it is that you filled out. Nobody has access except you. It's the way the app was designed. If we are hoping to gather data through the app, through another study, you would then have a sign in. You would acknowledge that people have access to your information. It would be anonymized by the time it got to the database. Everything would be removed. And it is extremely important for us that we follow not just the North American, but the European access to privacy information security. In terms of the GRIDD study information that we ran, which was about a year ago, and we collected some cutaneous lymphoma information as well as other disease area information. The only people who have access to that information where it's not cleaned is a company who also understand all the privacy and security implications. And researchers only have access to the clean, anonymized data. So there is no worry of a breach. It is not sitting on the cloud. It is in a very safe and secure spot. And so we do our research and our analysis from the cleaned, anonymized data. And we would always do that. Any study that is run through GlobalSkin, and I'm sure through the cutaneous lymphoma, follows those rigorous steps.
Absolutely. Absolutely. So that was actually a little clarifying for me. So you're not currently still collecting data on either the tool or on the grid. So
No,
at this point, you have the data that you're using, that you're publishing on, and that you are validating and expanding the access and information to clinicians and really
that's right.
getting people engaged. That's excellent.
Yeah. We hope to do it again because it's such valuable data. But
Yeah.
currently, no, we're only using what was collected to the study that ended about a year and a half ago. So no new
Okay.
data.
Great. And so there is a potential second round of capture from a grid type of survey.
We really hope so. We'd like to do it in partnership with an organization such as an ILDS, which is the International League of Dermatology Societies. So we are looking for partners because the data that was provided is so valuable. We know the WHO is very interested in our measure and in the data and in skin. We know that there would be more interesting, slightly different questions that we could collect that would have an even greater impact. So we are hoping to partner in the future and do the same thing again and maybe get enough data from cutaneous lymphoma patients to be able to do a fantastic subset of burden disease on cutaneous lymphoma patients as well. But you do need a lot of participation to create a valid subset.
Yeah. But
Yeah,
no, that's amazing, and certainly something that we will keep an eye on as a partner of Global Skin.
love
So
that.
yeah, this
Yeah,
is very exciting. So we have covered a lot of information in the time that we've been together. I recognize that we're getting close to our time, but want to make sure, is there anything I missed? Is there something, Allison, that people who, are out in our community who might be seeing an article here and there or wanting to use the app, anything else that you can think of that they should know about this work that you and your organization is doing, and why it's so valuable and important as an alliance partner of the foundation?
so I guess a couple of things. One, when it comes just to research in general, researchers don't always do a great job of sharing with you why research is so important. It is so important. And we're sorry that you don't always know why or what it is we're doing with it. Sometimes it's because it takes so long to clean it and analyze it that we don't necessarily get back to participants in a timely manner. And that's on us in terms of saying, thank you so much. You have no idea how valuable it is. Another reason why it can feel like you participate in these programs and it just goes into the void and you don't really know what happened is because the work is behind the scenes. So there really isn't anything tangible that we can share with you. We underestimate that might be important for participants to know that, yes, why you're participating is great. It can also be pushed upwards. So it can take a long, long time to do. And as you grapple with, say, a volume of information, you might be putting it together for a body such as a WHO or a payer, and it might not be allowed to be shared. So it's under wraps, it's private, it's only meant for a very specific audience, and therefore we can't share data that's coming out with you. And you can't really know that it happened because of the audience that's intended for. So just understand as patients, especially say it's a global skin or a cutaneous lymphoma, we so value your participation. It's so important that you do it. And we will try really hard to let you know that the effort you put in is being put to good use. Don't always do a good job at it, but it really is very, very appreciated that you participate. So I did want to let you know that.
Appreciate it. That's huge because we're just as guilty of it, right? We're moving through fast. We know the value as an organization and we don't always do a great job of communicating
Yeah,
back either. So thank you for that.
you're
That's
welcome.
really important.
It has been a year and a half since we asked cutaneous lymphoma patients to fill out the GRIDD study, and we're just now getting to the point where we might be able to share impact data back to our patient organizations. That's a long time. People are like, I've forgotten about you. I've forgotten about it. I didn't think it mattered. Yes, it matters big time.
Yeah. Well, we will look forward to any of that shared data and be sure to circulate it in a newsletter article, an e-news message, or maybe you and I will circle back and do another podcast once you have that data
That
ready.
would be
What
amazing.
whatever works for delivering the information in an effective way to the community.
I did want to add another thing. One of the things patients made clear to us as we developed PRIDD, and I think it's becoming more widely acknowledged globally, is the burden, the mental health burden of everything, not just of disease, but of going through a pandemic, of our social media era, of our political era. I think there is a huge concern, rightly so, on mental health. And that was made clear to us by the patients as this measure was developed. And one of the exciting things we're learning with this measure is it is also a predictor of the risk of mental health, some kind of mental health manifestation, such as
Oh,
anxiety or of depression. And it's interesting to me because there are measures on anxiety and on depression, but this measure was developed so well by patients who knew exactly what it is that they wanted to tell us that as we mapped this measure with mental health measures, there's a clear connection between the two. So as you look at PRIDD as a measure of choice when you're looking at burden of skin disease, and this includes with cutaneous lymphoma patients, you can then look at it, and if you're high on the social or high on the psychological domains of the measure, it is very worth having a discussion with your healthcare provider that you're at risk for a mental health challenge as well.
wow, that's an excellent side benefit to the app as
Okay.
well because improved quality of life is full circle, right? So that's amazing.
And it's the benefit of a patient created measure. So patients participating, patients telling us what's important as part of the process of measuring them means that we're really, really getting a very robust story of what's important. Yeah.
Thank you. Thank you. So anything else?
Ooh, let me see. We're being very rigorous. We're being extremely high attention to detail. Um, and we're trying really hard to engage and share. So no further.
Excellent. So my outcomes, we are going to share links to the publications on your site, and we are going to share a link to where people can get this app and get it downloaded on their phone so they can actively start using it to improve their diagnosis, their quality of life, and their communication with their physicians.
Absolutely. And if they want to participate in studies or provide you with opportunities to have a study, we'd be happy to support that.
Wonderful. And definitely that, because, the research and trying to really find solutions is an important component of the work that we do for
Yeah,
sure.
it is.
Well, with that, I want to say thank you. That brings us to the end of this episode of Coffee and Community, the Cutaneous Lymphoma Conversations. We hope you, as our audience, found this discussion as insightful and inspiring as I did. Before we go, I'd like to once again thank Allison for her time and commitment to our community, as well as thank our sponsors and donors. Without their support, programs like these would not be possible. If you liked this episode, please follow us and please subscribe to our podcast. Thank you for joining us today. Until next time, stay informed, stay connected, and take care.